My name is Kristy Champion, and I'm a part of the NHSN Acute Care Analytics team. Today, I will be providing information on the NHSN analysis for the digital quality measures and providing a sneak peek into the medication safety components glycemic control module. So let's first start out with the objectives for today. By the end of the presentation, you will be able to understand NHSN's new digital quality measures and process and data flow, describe how the NHSN Digital Measure Reporting Plan determines data analysis reports, and navigate and access the NHSN data analysis reports for a preview of the hypoglycemia digital quality measures. To begin, I'll provide an overview of the digital quality measures. In alignment with the CDC's Data Modernization Initiative, NHSN is developing fully automated digital quality measures, or DQMs, based upon nationally recognized standards. We also leverage measurement science, rigorous benchmarking, and risk adjustment at the facility and patient levels. There are important benefits of DQMs that I want to highlight. It reduces time for data collection, which minimizes reporting burden, provides patient-level data for risk adjustment and stratification. It removes potential biases due to different interpretations, which improves accuracy, validity, and quality. It also adjusts measures quickly in response to changes in practices, which reflect speed and efficiency improvements. In order to harness these benefits, we leverage policy, stakeholder engagement, and evolving the technical components. With advancing technology, we improve data quality, optimize data aggregation, and enable measurement alignment to improve patient care. Next, let's compare the manual or semi-automated measures to the improvements that digital quality measures, or DQMs, offer. As you see on the left, with manual or semi-automated measures, the data standards are specific to the measure and the organization from which they are reported. Data are often pushed, which requires NHSN to wait for the data from the facility. Data is typically aggregated, so often only facility level risk adjustment is available. And the measures are predetermined prior to transmission to NHSN. With digital quality measures, as you can see on the right, data can be applied to nationally recognized standards across EHR vendors, facilities, and agencies. Data can be pulled, allowing for real-time surveillance feasibility. And since the data are at patient level, risk adjustment is possible, and measures can be adjusted after transmission to NHSN. Now let's discuss some of the technical aspects that make the magic happen. NHSN's FHIR application leverages the NHSN link to report DQMs. NHSN link is our open source public health application for FHIR reporting. FHIR stands for the Fast Healthcare Interoperability Resources. It's an international standard for healthcare data exchange published by the Health Level 7 International. These standards include a standards-based approach to accessing a patient level versus aggregated data. The EHR vendors, hospitals, and government agencies are increasingly leveraging this technology. And most EHRs have FHIR capability, but the FHIR API, or Application Programming Interface, must be enabled. NHSN Link is a secure connection to the facility's EHR endpoint, which then pulls the selected FHIR resources required for the DQM calculation. So now that we know a little bit about FHIR and NHSN Link, we'll move on to the high-level process flow from the facility to NHSN. NHSN Link identifies patients of interest from the facility's EHR via a secure connection with the FHIR API. Next, the NHSN Link queries the EHR to identify the data elements, such as medications and labs, required for measure calculations on the patients of interest. Then, data is further validated and analyzed. And finally, the NHSN application runs algorithms to determine if the patient meets denominator and numerator criteria. From here, analytics are performed and measure reports are made for NHSN users. So before rolling out new technology systems and analytics, piloting is an important step to ensure usability and validity. So the NHSN Collaborative, or NHSN CoLabs, are part of this DQM development process. They are a small group of sites used to pilot the measures. Sites must already have the technical infrastructure in place for piloting, such as being FHIR ready. This partnership allows NHSN to test the feasibility and validity of the new surveillance concepts. Next, let's discuss the quality measures that are under development at the NHSN. Several DQMs will have modules located within the patient safety component, as you can see in the center of your screen, including measures for community onset adult sepsis mortality, respiratory pathogen surveillance, hospital onset bacteremia and fungemia, healthcare facility onset antibiotic treated C. difficile infection. NHSN is also developing 2 new glycemic control measures for medication-related hypoglycemia and hyperglycemia, which will be located in the new medication safety component, as you can see in the upper right-hand corner of your screen. We will highlight hypoglycemia later in this presentation. So let's do a quick knowledge check and be a little interactive here. What is one benefit of digital quality measures? Please answer in the chat. So let's go over the answer. The question again is, what is one benefit of many of the digital quality measures? The answer, all of the following are benefits of the digital quality measures. Reduce time for data collection, provide patient-level data for risk adjustment and stratification, remove potential biases, and adjust measures quickly in response to changes in practices. Thank you so much for participating. So now let's dive into the NHSN Digital Quality Measure Reporting Plan. So the Digital Measure Reporting Plan, also known as the DMRP, it plays an important role in the collection and analysis of data for the NHSN digital quality measures. This is similar to existing monthly reporting plans, which a facility will complete a DMRP as a step in the process to begin reporting data for the NHSN digital quality measures. So what's the purpose of this DMRP step? It authorizes NHSN to query the facility's FHIR server to collect EHR data elements per the DQM protocol. So it's an agreement to comply with the DQM reporting instructions, which includes NHSN location codes and other standardized value sets like RX norm or LOINC. It also selects the measures and reporting period for the data analysis reports to be available. After interested facilities enroll in reporting for one or more of the NHSN digital quality measures, they must complete this digital measure reporting plan. The DMRP is found in both medication safety and patient safety components. To participate in DQMs, an annual survey must be completed by March 1st of every year. After March 1st, facilities will be prevented from entering new DMRPs until the completion of applicable surveys. Okay, so we've heard about the steps, but let's go over the order in which they should be done. So first, the facility enrolls in NHSN and activates the medication safety component or future components that will be available. Second, the facility completes the annual hospital survey for the component of interest, such as medication safety. And third, then the facility will add the DMRP, or Digital Measure Reporting Plan. So first enroll, then annual survey, then DMRP. Let's talk about where you can find the DMRP. You can easily find the DMRP by navigating to Reporting Plan, select Add, select Follow, as you can see in the center of your screen, for the measure of interest. In the future, for medication safety, you will most likely see, hypoglycemia measure reporting and then hyperglycemia reporting. For patient safety, as they're developed, you will see an ever-increasing list as well. So just to note, this example is from medication safety component. The patient safety component will have an additional selection screen where the user must select monthly reporting plan or DMRP. Let's do another quick knowledge check. What must facilities complete prior to entering their digital measure reporting plan? Please answer in the chat. A hint is this should be completed every year before March 1st. Let's go over it, and thank you for your participation. So the question is, what must facilities complete prior to entering their digital measure reporting plan? And the answer, as is across the board in the chat, is the NHSN Annual Hospital Survey. Thank you again. So next we will discuss the NHSN new digital quality measures analysis reports, just what you've been waiting for. In this section, we will highlight the medication safety component, glycemic control module, hypoglycemia measure. So let's first talk about how that data gets into the reports to begin with. So using the glycemic control DQM as an example and demonstrating the process taking place within the CDC cloud, we would consider encounter and patient data, as you see if you follow from the left side of your screen, medication data, preferably using medication administration, but medication request will be used if medication administration is not available. And then the blood glucose test data. Moving on, we see that once again, PHI and PII are decoupled from the data at this point, and the data elements are then linked to identify patient denominator and qualifying glycemic events during an inpatient encounter. Lastly, as you follow on the right, the linked data elements are used to generate analysis reports and are provided to the facility through the NHSN application. Again, reports may include line listing, aggregate reports, or measure calculations. So I know this is getting really exciting. So let's talk about what will be available in the module. So the analysis reports will be available in the NHSN application as the new DQMs are implemented and rolled out. They will include metric calculations for a facility, as well as selected supplemental reports, such as line level listing of events by location. Additional analysis reports, for instance, group user reports, will be phased in. Glycemic control hypoglycemia will be the first DQM to be implemented. All right, so let's get down to the nitty-gritty details of some of these metrics. So for this presentation, we'll continue on with glycemic control hypoglycemia and highlight calculations for the primary and secondary metrics of the new DQM. First, we have the primary metric aligned with the Centers for Medicare and Medicaid Services, CMS, reporting requirements. It calculates the number of adult inpatient encounters where the patient was administered at least one hypoglycemic medication and suffered harm of a severe hypoglycemic event. over the number of adult inpatient encounters where at least one diabetic medication was administered. Moving on, this slide shares the secondary metrics for the new glycemic control module, hypoglycemia. So for metric 2, it evaluates hypoglycemia event days, or an inpatient day with at least one documented hypoglycemia event. Metric 3 analyzes recurrent hypoglycemia event days or medication days with at least one documented hypoglycemia event that has been preceded by another inpatient day with a hypoglycemia event within a 24-hour period. Please note that metric 2 and 3 will be evaluated at the following blood glucose thresholds: less than 40, 40 to 53, and 54 to 69 milligrams per deciliter, corresponding with severe, moderate, and mild hypoglycemia events, respectively. Metric 4 calculates severe hypoglycemia resolution time, or the median time between a hypoglycemia event and the first blood glucose of normal range or above or equal to 70 thereafter for all patients. Don't worry, you don't need to remember any of this. This will all be provided in the materials, metrics, and protocol that you will have access to. So if you prefer seeing the secondary metrics by formula, we can go over that really quick. And these are the formulas that we use to calculate those metrics. There are a lot of nuances and details within them, but we're just highlighting for today. For metric 2, hypoglycemia event days is the total number of hypoglycemia days per month over the total number of hypoglycemic medications per month. Metric 3, recurrent hypoglycemia event days. It's the total number of recurrent hypoglycemia days per month over the total number of hypoglycemic medication days per month. And metric 4 is severe hypoglycemia resolution in minutes. It is the median in minutes immediately following the resolution of the hypoglycemia event. Moving on from the metrics themselves, let's talk about what to expect in the reports during the rollout phases. During the first phase, as you can see on the left, there will be line lists. For example, these line lists can include all inpatient encounters with at least one hypoglycemic medication and severe hypoglycemia encounters for adults. This can also include a rate table, such as severe hypoglycemic encounters for adults, which is metric 1. Separate reports will be generated using medication administration or medication request data, depending on which is submitted by the facility. During the second phase, as you can see on the right, there will be additional line lists, frequency tables, and rate tables, including stratified rate table reports for metric 1 and the calculation of all secondary metrics. So now let's look at where the reports will be available within the user interface. Looking at this illustration, to find the analysis reports, you go to Analysis and then click Reports. Here you will then see a tree view of the reports for digital quality measures and modules, continuing with the hypoglycemia example. Note that you will see both medication request and medication administration options, but they will be populated or blank depending on which your facility submits. So if your facility is using medication request data, you will only actually see data within the medication request line lists or rate tables, and then you will not see it with the medication administration, and the vice versa is true. If your facility submits medication administration, you won't see medication request. Data, I should say. The filtering and modifying screens will be very similar to that of patient safety, but refreshed and modernized. Now we can look at some examples of reports you can expect. This is an example of the hypoglycemia primary metric line listing report. You will have the ability to sort, filter, and set time periods. This will be similar to other modules. So as you see at the top right, these have default sorting schemes, and you can adjust those. You can do by page, time periods, and there are several different filters that you'll be able to use. Along the blue table, there will be, you can see some of the variables that will be available. Okay, moving on, we have an example of a rate table for severe hypoglycemia encounters. You have the ability to set the date ranges, filters, and group by. Again, there will be defaults, but you can change those. And these are some of the variables that you will be able to see, such as the org ID, the summary by year and month, severe hypoglycemia encounters number and calculations, the hypoglycemic medication encounters, and the percent of hypoglycemic medication encounters with severe hypoglycemia. So that you want to know when this is going to be available. The NHSN Glycemic Control Module is expected to be open to early adopters next year, 2026. If your facility is interested in participating as an early adopter, you can express interest at the link in this slide. Of note, your facility must be able to report measures via FHIR. Participation is contingent on NHSN release schedules and meeting technology requirements and is not guaranteed. During this presentation, we have reviewed how data flows through the NHSN DQM pipeline, the purpose of the NHSN Digital Quality Measure Reporting Plan, and the location of the NHSN data analysis reports when available. Thank you so much for joining me today for this presentation, and please post questions in the annual training community if we aren't able to address them in the Q&A today. You can also submit questions to the NHSN Help Desk, to the Service Desk. And if you do not have a SAMS login, you can do nhsn at cdc.gov, include annual training 2025 in the subject line. Thank you.
Oh, can you hear me?